Hey, this is Henry Sanders with another daily episode of Real Talk. I want to thank our sponsors at Park Bank. Thank you for everything that you're doing. And special shout out to my boy Jeff Mack over there. We'll see you, brother. Hope all is well with you. Today we have a friend of mine who was someone who's done a lot in the community. Actually ran for lieutenant governor at one point, and someone who was one of the first responders in the state of Wisconsin, and wanted to make sure we could get their perspective on what's going on. He has so many titles. I don't know what title to even give him. So, my man, Mahlon Mitchell, how you doing, my friend?
Good, Henry. Glad to be with you, and thanks for having me.
Yeah, what are your titles?
Well, I'm a lieutenant with the City of Madison Fire Department, and I'm the president of the statewide firefighters union, the Professional Firefighters of Wisconsin. State president there, and I'm also our local president here in Madison and Greater Dane County for Firefighters Local 311.
That's a lot of power. Sounds like, that sounds like.
It's actually I work for a lot of people.
Right, unions, right? So you answer for a lot of people.
Right, so I'm elected. So you're not you're in control, but you're not necessarily the boss. What you are is working on behalf of the members that do this job in firefighting. So that's why I enjoy being able to actually not only be a first responder, but able to defend and work for the first responders at the state capitol, and contract negotiations is it's a hell of a time.
Yeah. So how is it, as for first responders, what's the environment like right now? There's so much going on with the COVID-19, and you guys are clearly an essential business organization, so you have to be out and about. What's the mindset of firefighters right now?
Well, believe it or not, there's a lot of uncertainty because this disease is spreading like nothing that I've never seen in my lifetime, and a lot of folks hopefully will never see again. So there's a lot of uncertainty, but we train. We don't train specifically for COVID-19 before it came, but we train for something like communicable diseases. EMS, the majority of us are trained in medical service and provide medical service at our fire departments. So we're trained, equipped, and ready to do the job. Our protocols are changing every day, matter of fact, every hour, based upon the information we're getting from different venues like the CDC, our federal government, and our state government. But, everything we do, it's locally executed. The state manages it. The federal government hopefully supports it, which is another issue. But everything we do, we have to execute. So our training is very important. That's what we rely on right now. But we have a lot of the same uncertainty as to when this will hopefully we can get a grip on this, or at least kind of lower that curve as everyone else does. Because we have families as well. And imagine us, we're out there responding to our community. But anything that we have, unfortunately, we're taking home to our families.
Are you tracking how many firefighters have gotten the coronavirus? Do you know
those numbers at all?
So we are tracking among our locals. So my association, we represent about 4,000 firefighters and paramedics across the state. We have 60 locals. So we go far up as Superior, Wisconsin, Ashland, and all those areas, and far south is Kenosha, Beloit, Racine. And we have everything in between, including the bigger urban areas like Madison, Milwaukee, Green Bay, and the like. We are tracking among our members, but realize we don't represent all the firefighters in our state. So among our membership, yes, we are tracking. And then we're trying to trace as well. We have a couple, we just got off a phone conference with the governor about an hour ago that we're looking to obviously have the PPE we all need, but also have priority testing for first responders. And it's not to be selfish, saying that we're better than anybody else, but the reason we need priority for testing is so that we can get back to work. Otherwise, a 2-week quarantine, and maybe you have no symptoms, and maybe you have not contracted the illness or the virus. That's 2 weeks you could have been helping out your community. So we are tracing among our members as much as we can, trying to back that up with data and give it to the state.
What are you doing to keep your people like you and other your peers to stay safe? What are you guys doing? There's certain things you can do that be safe. Mask, I'm assuming, and gloves. What do you guys do?
So we wear normally a full, if we know it's a suspected COVID-19 patient, our PPE, which is personal protective equipment, consists of gloves, goggles, an actual N95 mask, a respirator essentially. Also a shield is where it's a coverall that we wear over our gear if we know there's a suspected COVID-19 patient. Now, knowing there's a suspected or that there is a COVID-19 patient, someone that may have contracted it, is obviously, we're responding to someone who thinks they have. So we're taking a lot of precautions that we've never taken on calls, such as we are putting masks on every patient we come in contact with. So if you call 911, and hopefully none of the viewers have to, but if you do, if you have a broken leg, we're going to put a mask on you because, again, we do not know where this disease is going to go. So we put a mask on all our patients. We all wear masks, don mask now at every call. And right now, it's for us, we got to protect ourselves so that we can protect others. And if we have a suspected firefighter or EMS professional that has COVID-19, we're getting testing right away, hopefully. We can get that test back within hours, actually, but normally up to 24 hours. And the person asymptomatic or has no signs and symptoms or is not sick at all, we normally give them 72 hours and they can come back to work. So we are doing a lot by way of protecting ourselves. But again, there's a lot of unknowns with this disease or virus.
Yeah, are you guys impacted by the economy? I mean, like the people are, people like small business are being impacted, which means tax revenues being impacted. Is this impacting your budget? Or are you guys seeing a need for more firefighters because you're getting more calls? Like, how's that playing out for you?
Yeah, it's actually, for that question, Henry, it's too soon to tell. There's definitely going to be a impact on municipal budgets for the coming years because buying all this PPE, buying additional equipment that we need to do our jobs is going to cost. Folks that are quarantining, obviously they're off, so they're not working. So there's someone that has to backfill that position, but also figuring out how we're going to make sure that person that is sick stays whole financially. That's a problem. Businesses not having as much revenue come into the state and the local municipalities, that's a problem and a concern. We had a surplus for the state budget this year. I think that's looking like it's going to be most of it wiped away possibly. So hopefully what they did, the federal government, supporting the local and states is with the FFCRA, the Families First Act, and now the CARES Act that came after that. And we hear there's another stimulus package that's out there to help small businesses and municipalities. Hopefully that money will be enough to keep everyone afloat.
Are you guys getting more calls, or is it about the same or average? Has it gone down, you think?
You know what? It depends where you are. Like, for instance, I work right downtown here at Station 1. We cover portions of the campus, and a lot of the campus spills over into what our territory is. We're actually seeing, at times, less medical calls because I think people are staying at home, right? So there's less accidents or things that happen to commuters and people and at work, at bars, at restaurants if they're at home. Now, all the bars and all the restaurants are closed, so that takes away a good segment of the population and density downtown as well. But it depends where you work at. But we are seeing a drop in some calls, some parts of the city, but a rise in others. So, it all depends where you're at at least in the city of Madison.
Do firefighters now, when you're working, is it recommended? This would be tough if we ask this question. You guys go home, and do you have to isolate yourselves from your family when you go home? Like, what's the recommendation? Because you guys could be exposed easily. So, do they have recommendations for you?
Yeah, it's tough. We've gone from wearing the N95 mask, which has a filter on the end, only on calls that we suspect a COVID patient, to actually wearing a mask on every call, and again putting masks on our patients, to self-isolating or quarantining. And if you're self-quarantine or the job says you need to quarantine, trying to stay away from your families as much as we can. The good thing about Madison, at least, is it has supported its first responders. We were able to get emergency leave if needed, if you need to quarantine for 2 weeks. That'll keep you whole. And the city is also contracted with a couple hotels around the city that those that don't want to be around their families because they don't want to, in turn, give it to their families, there's a place that they can go stay for the 3 days or the 2 weeks while they have the disease or while they're waiting to see their test results or being quarantined.
That's be a tough decision. I mean, every day you guys are out there around people. You could be exposed at any time. And then you have to go home, be around your families. That's a tough decision. That's tough.
Well,
tough.
You just don't know, man. Because we run, and I always fret when I say this because I don't want to say it wrong. Those at hospitals in the emergency room, they are obviously qualified, are highly more qualified than us to do emergency medical care. As doctors and as nurses, they have more education in what we're doing. And obviously we can't do anything without the hospitals. But for the most part, I would say their environment is controlled because we're bringing them there or at least people are coming in, driving themselves, are hurting bad. But again, I'm just trying to say that as a first responder, we are there first. And we are running or walking into uncontrolled environments. I mean, all we know is when we arrive on the call is what the actual caller or person that's relaying the message is telling us. And you can imagine when people are in a panic state, what kind of information you're going to get. I mean, they're just wondering, when I call 911, how soon will you get here? And then you have the 911 dispatcher who has to ask a series of questions to relay that information back to us while we're getting dressed and getting our PPE. So we're trying to listen to radio. We're trying to put our PPE on, our gear on, and be well equipped to do the job. And we're going to be there hopefully in 3 to 4 minutes. So you can imagine sometimes we run into uncontrolled environments. So that's why, when legislators and people at the Capitol, when they vote on things, they should, put that in the back of their minds.
Yeah. And I know there's some new legislation out that says, and you have to correct me if I'm wrong on this, but how I read it was basically saying that now if you're a first responder, you have to prove if you get COVID-19, if you get the coronavirus, you have to prove where you originally got it from, right? You have to prove that you got it on the job. So as a first responder, as a firefighter, if you're out putting out a fire, whatever, being the first to respond to an incident, and you happen to get connected, you happen to get the coronavirus, you would have to be able to go back and say, before you got unemployment, you'd have to, some insurance, is it insurance or unemployment?
Yeah, workers' compensation.
Workers' compensation, that you would have to actually, at that point, be able to pinpoint who gave it to you in the apartment complex or whatever. You have to be able to pinpoint that. Do I have it right?
That's it. And initially, the bill read that it was a rebuttable presumption, which means that the employer can say, no, you didn't contract it on the job. That's the rebut part. But the presumption at least says, as a firefighter or EMS personnel, we are assuming or presuming that you get COVID-19 while being a firefighter or a paramedic, because you come in contact with so many people in any given shift, because you're not able to every time have the adequate PPE on. Like, for instance, just over the weekend, we had, I think it's a 24-unit apartment building go up in flames. We had to call a second alarm, which means more than our initial response of fire trucks and fire engines. When you have a situation like that, and we're not working with masks, obviously, anymore, and our social distancing and other precautions have to go out the window because we work as teams. We work very close proximity to each other, doing a lot of our tasks. So you had however many firefighters at that call that were interacting with the public, because the public were coming up to us, asking us questions, and going in with their brother or sister, going in to fight the fire. And they could have got it there, but there's no way of pinpointing it back to that call because, one, it's not a concern at the point, putting the fire out is, and two, there's no one there getting tested, right?
Right.
So how do we pinpoint and track a illness that even scientists and doctors cannot track? So our issue, again, is that it needs to be a presumption so that it initially protects the firefighter or paramedic, And then if there's an issue, then the employer can come back and rebut that. But like you said, the bill was originally written to have a presumption. The amendment changed that in the current legislature, and they scaled it back to where almost it's not helping us as much as it could.
Who made the amendment to make it like this now? Do you know?
So the amendment came through the Assembly, and the Assembly and the Senate, as you know, are both Republican controlled. The governor, this was one of his provisions that he got put in the big bill that they signed last week. It's essentially making a presumption. So someone in the Assembly or the Senate didn't like the presumption, or some other entity talked to their elected officials and didn't like the presumption. So it's sad, but we're going to keep on pressing on and keep on working and keep on grinding and get it done, man, so we can take care of our first responders across the state.
Is there anything, before we go, is there anything that the public can do to help first responders? Is there anything that you think could be helpful, or anything that public can do to be supportive of what you guys are doing? It's so important. Like you said, you're the first there, and a lot of uncertainty in the times where people don't know what's going on. So is there ways that people can be supportive for what you're doing?
You know what? I would say support your local firefighters any way you can. And that's just not, obviously, everyone pays taxes and helps to support firefighters monetarily. But, support your local firefighters when you see them. None of us do this job for thank yous. And you'll never hear a firefighter call himself a hero. We're doing the jobs that we are paid to do and that we love. But, supporting your firefighters, meaning by when there is those that are politically active, when there are things coming up and you see that you can make a call or to your local, or be a local issue or a statewide issue, make that call. And we appreciate that. And the Stay Safer at Home Act, that is helping lessen the burden that we have around the state. I know it's hurting businesses, and I don't think that Governor Evers, I can't speak on his behalf, but I couldn't imagine him wanting to close businesses for 60 days. But, we're doing, and he is doing what he believes is the right thing to do to keep people safe. And as firefighters, we don't get involved in that conversation. Our main priority is make sure our communities are safe and that we also can go home to our families at the end of our shift.
Well, thank you for all that you do. We hope that you stay safe, my friend. And I can see you at work now, actually. I can see you working now today. Yeah, just be safe.
Quarantine in my office.
well, it makes me nervous that you're working around people, but stay safe and healthy, my friend. Thanks for all the first responders. Please tell everyone there from Mass 365 we have nothing but love for them, and we're supporting you where we can. And thank you, friend.
And just to be clear, Henry, I want to make sure it's clear. I'm in an office. There's only 2 people here, or me by myself. I don't want people thinking that I'm saying follow the order, but I'm not. So just to be clear, man, there's only 2 people here right now.
All right.
It's
on the record. Thank you. And thanks for another episode of Real Talk, and we'll see you next time.